So the fairly obvious question is, why did we ask a neurosurgeon to come and visit a cardiac center? So last summer, Dr. Gupta hosted a CNN documentary called The Last Heart Attack. He said that, except in rare circumstances, heart disease is entirely preventable through diet and exercise.
So again, I'm just excited to be here. You know, the institutes like this, I think, in part, I never wanted to really be in a place like this because of my own concerns about my family history, but it's exciting to see that places like this exist to be able to take care of patients. I do believe, as lots of cardiologists also said in the documentary we did for CNN, that we can prevent a lot of heart disease with what we know right now. Without some major breakthrough in the world of cardiology, we can prevent a lot of the disease that you all spend so much time treating. And I think that's something that everybody wants. I mean, I certainly want it for myself, especially having seen what my father and my grandfather went through. I finished medical school about 20 years ago, and almost since that time, I've been attending these meetings in hospitals where doctors get together and openly discuss their mistakes. A lot of people in this room have attended meetings like this, but I was sort of surprised when I started doing some research on this, how many people outside the walls of medicine didn't know much about these morbidity and mortality meetings. Closed-door meetings, insiders-only gathering meetings where doctors would basically hold each other accountable for mistakes. Say, you messed this up, you made a mistake, here's how not to do that again, and by the way, everyone else listening in this room, here's what you can learn from this as well.
We actually have a goal and a target in this hospital of reporting things that either have happened to patients that lead to an outcome that's not expected, or things that might have happened if somebody had a good catch and avoided something happening. And our target used to be 2,000 reports a year. I'm happy to tell you that we now expect over 5,000 reports a year, and this year we'll probably have about 5,500. You'll notice, Michael, that he's now a member not of the Kremlin Neuroscience Center, Peter Munk Cardiac Centre.